Hello everyone, in today's video, we'll be going through the targeted drug delivery systems. This video would be an easy explanation for the B.Pharm as well as the M.Pharm students who are preparing for their written exams. Targeted drug delivery is the method of directing therapeutic agents to a specific site in the body for achieving optimal therapeutic effect while minimizing systemic side effects. The reason targeted drug delivery system is important is because it enhances drug's efficacy, reduces the toxic effects, and improves patients' compliance. Concepts involved in targeted drug delivery. First, passive targeting. Passive targeting relies on natural distribution of the drug. An example for this is enhanced permeability and retention effect in tumors, more commonly known as EPR effect. Second, active targeting. Active targeting uses ligands such as antibodies, peptides, vitamins to bind specific receptors on target cells. Active targeting increases drug accumulation at the disease site. Third, stimuli-responsive targeting. As the name suggests, the drug release is triggered by pH, temperature, enzymes, or external stimuli such as light and magnetic fields. Let's have a look at events in targeted drug delivery. First, drug administration. The drug is administered through oral, intravenous, transdermal, or some other route. Second, circulation in blood. The drug must remain stable and avoid premature clearance. Third, recognition by target cells. This involves the ligand-receptor interactions in active targeting. Fourth, cellular uptake. Here, endocytosis or receptor-mediated internalization occurs. Fifth, drug release at target site. Could be controlled or stimuli-triggered release. Sixth, therapeutic action, where interaction with cellular or subcellular targets occurs. Biological processes involved in targeted drug delivery. Endocytosis, the uptake of drug-loaded nanoparticles by target cells. Receptor-mediated binding, this ensures selective attachment to the target cells. Intracellular trafficking, the drug moves to specific organelles such as nucleus or mitochondria. Metabolism and clearance, the biodegradable carriers allow safe degradation. Immune evasion, the surface modification prevents recognition by macrophages. An example for this is pegylation. Tumor targeting, the nanocarrier injection helps the drug to circulate in the blood. Accumulation in tumor tissue is done via EPR effect. Receptor recognition and binding happens when ligands bind to tumor-specific markers. With the help of endocytosis, the drug enters the tumor cells. The drug release happens inside cells, which is often triggered by pH or enzymes. Brain-specific drug delivery. One of the commonly occurring challenges while delivering the drug to the brain is the presence of blood-brain barrier, which restricts the drug's entry to the brain. Strategies to overcome this challenge are lipid-based carriers, which includes liposomes, solid lipid nanoparticles for BBB penetration, receptor-mediated transport. It's done using transferrin or insulin receptors. Nanoparticle surface modification. This involves pegylation or ligand conjugation. Intranasal delivery. It involves the direct nose to brain route, which bypasses the blood brain barrier. Let's have a look at the biological processes involved while brain targeting. First, circulation in blood. Nanocarrier avoids degradation. Second, recognition at BBB. Ligand binds receptor on endothelial cells. Third, transcytosis across the blood-brain barrier, which involves the receptor-mediated transport. Fourth, drug release in brain tissue, which causes the targeted therapeutic effect. Some of the applications for this are: first, in the treatment of neurodegenerative diseases such as Alzheimer's or Parkinson's disease. Second, treatment for the brain tumors. Third, it's also used for the drugs that need to be delivered for treatment of CNS infection. To conclude this video, we can say that targeted drug delivery enhances the efficacy and reduces systemic side effects. The tumor targeting exploits the EPR effect and ligand receptor strategies. Brain targeting requires overcoming the blood-brain barrier using nanoparticles and receptor-mediated transports. The future advancements include smart carriers, gene delivery, and personalized medicine. If you'd like to read more on this topic, you can refer to the mentioned literature.